Hello and welcome to the New Book of Daniel podcast. My name is Daniel Bobinski and I'll be your host on today's adventure. Today you're about to hear a very informative interview with Dr. Vladimir Zelenko. You may have heard his name. He's a doctor in upstate New York, with a very tight-knit community of 35,000 people in a 1 square mile. He was their primary care physician, normally seeing probably 50 patients a day. When the COVID crisis hit, that went to 250 to 300 patients a day. A lot of those folks went to the hospital. Many of those never came home. Dr. Zelenko set out to find a pre-hospital treatment, and he came across hydroxychloroquine, zinc, and azithromycin. When he gave his patients that combination, a whole lot fewer of them needed to go to the hospital. In fact, it was an 84% reduction and a corresponding reduction in the number of deaths. In the next 45 minutes, Dr. Zelenko is going to share with us what went on behind the scenes, how hydroxychloroquine became politicized and vilified, and what he did to beat the system to find a way to deliver zinc to our bodies in a way that would make it in and prevent viral replication. So, you need to know this too, by the way. Normally when I have an interview with somebody, I ask a fair amount of questions. I had my questions lined up for Dr. Zelenko. We started talking, and I realized as he was talking, I didn't need to ask my questions. He was answering them as he went, so I just let him talk. You're going to find this a very valuable interview. So for your own sake, for the sake of those that you love, I ask you and urge you to pay attention to what he has to say, not only for your health, but also for the truth of what went on behind the scenes. Let's go straight to it. Dr. Zelenko, thank you very much for joining us here on the New Book of Daniel. You became kind of instant famous when you contacted the White House regarding hydroxychloroquine. Is that correct?
Well, I don't know how famous I am. That's for other people to judge. But I'll tell you what happened in March. I was one of the first doctors in America, by necessity and circumstance, to have to treat thousands of patients with COVID-19 in the outpatient setting. And that was simply because I was a primary care doctor in a close-knit upstate community of around 35,000 people that got hit early. And it spread, very high population density, 35,000 people in a square mile. So it spread very quickly. And I'm essentially the primary care doctor for that community. So everyone started coming to me. And at that point in time, if you recall, the whole world was focusing on building more respirators, more hospital capacity. There was no emphasis on pre-hospital care. So the paradigm that we were using was telling patients to go home and what's called supportive care, Tylenol fluids, And if someone started to get difficulty breathing, then we would advise them to go to the hospital, and then a subset of those patients would get on a respirator, and around 80 to 90% would die. That was the treatment model in early March, and I didn't think that was very good. And so I started very quickly doing a lot of research online and trying to understand this virus, and then in a battlefield medicine mode, try to experiment with different things to see if I could mitigate the course of the disease, and with divine providence, and I really credit God for this, not myself. I stumbled across an approach, which by now, as everyone knows, is the Zelenko protocol, and it, in retrospect, this is now peer-reviewed, published data, internationally renowned journal, 84% reduction in the need for hospitalization in high-risk patients. So basically, a decrease in death rate in the high-risk patients by 84%. So I didn't know that at the time, but I'm not stupid. I saw people were going to the hospital and dying, and then I started giving them 3 well-known compounds, and they stopped dying, and they stopped going to the hospital. And I noticed that very quickly, so empirically, anecdotally. So I felt that I was significant enough information that I needed to convey it to the most powerful people in the world, a person in the world. So I felt I needed to get in touch and get the attention of the president. Now, how do you do that? I'm not connected. So social media. I asked my son, who was 17 at the time, to help me make a YouTube video because I've never made a video. And I didn't even know how to do it. So I made a video appealing to the president for help. And then 16 hours later, Mark Meadows, the president's chief of staff, calls me on my cell phone. This is another question, how they got my cell phone. But anyway, so I ended up having a nice conversation with Mr. Meadows. And then that led to a conversation with Stephen Hahn, Dr. Hahn, the commissioner of the FDA, which then led to a few podcast interviews with Rudy Giuliani, which those became viral. And since then, nothing's been the same in my life. You know, millions of people have seen it, and now I have heads of state governments consulting with me, and you know, it's now 9 months into it, and there's you know, hundreds, if not thousands, of doctors now following this paradigm, which we can discuss in a minute. But and it's making a real dent in the morbidity and mortality of the disease, and it's really common sense. Before we get into the actual drugs, because there are many at this point, it's two simple concepts. The Zelenko protocol is just common sense, which is identify the high-risk patients. You know, at that time, let me paint a picture for you so you should understand. It's second week of March. Usually my office sees 50 patients a day. We were seeing 250 to 300 a day. Half my staff was sick and out. The outpatient radiology and laboratories were closed. The hospitals were near capacity. And so it's a triage. It was a bomb went off, you know, a war zone. And I just didn't have time or resources to get to everyone. So that's where the idea of triage comes in, right? So I called my colleagues that work in the ICU, several hospitals, and I said, listen, which patients are dying? Which patients are you burying, actually? That's what I said. They said to me, well, the older people and those with medical problems. I said, okay, what about the younger crowd? We're not seeing them. So I realized that this virus it wasn't scientific. It was just more like conversation. But I realized this virus wasn't killing people equally, right? So when you have limited resources, so you try to put your energy and your resources where it makes the most difference, right? So I started cherry picking the high-risk patients. And those are easy to diagnose, so, you know, the older people or those with medical problems. And that's number one. Number two, I would start to treat them immediately. And that was simple because if you look at the CDC right now and the recommendations for treatment of influenza, the recommendation is to start antiviral drugs within 48 hours of the onset of symptoms, right? Because it's much easier to put out a small infection than a large infection. Again, it's common sense. A small fire is easier to put out than a large fire. Someone has cancer, right? God forbid, you don't wait until it becomes fully metastatic. You treat it when it's localized so that it's much easier to cure it that way. So COVID-19 is no different. You know, it's an RNA viral infection. It's much easier to get the virus under control when it's a little infection. So, but the problem was at that time, on average, if you look at the statistics, patients come in general, to the doctor on day 4 of an illness, simply because the first 2 days, oh, it's a cold, it's going to get better. It doesn't get better. Day 3, they call the doctor, usually get an appointment the next day. That's day 4. Patients would come on average day 4. We would do the testing, but at that point, the testing took 5 days to get back the results. That would bring them into day 8 or 9. Now that's a problem. By then they were very sick, and now we know why. The first 5 days of symptoms, the amount of virus is constant, relatively constant in the patient. But by day 6 or 5 or 6, it begins to exponentially replicate like a wildfire. So if you let a patient get to that point, then they get very sick very quickly. So you have a very narrow window when early intervention makes all the difference. So I realized that. So I started treating people, and this is the key, before I get the results of the tests, empirically, using clinical judgment. You know, it's very easy to diagnose this thing, you know. Very few things in medicine cause the loss of smell or taste. Flu-like symptoms are easy to diagnose. It was in the summer. It wasn't flu season. And even if I did think it was a flu, I could just do a flu test, right? If it's negative, then what else could it be? And if the whole family has COVID, you don't need to be a rocket scientist. All you need is common sense. So I started cherry-picking high-risk patients and treating those that had symptoms immediately. And at that point, I was using just 3 simple drugs, hydroxychloroquine, azithromycin, and zinc. Subsequently, since then, a lot more information has come out, and there's many other options. For example, ivermectin or steroids, either inhaled or IV or oral, blood thinning medications like Lovenox or Plavix. And this is where the art of medicine comes in. You know, each patient is unique, each patient's situation is unique, and we have several weapons at our disposal, and we have to custom tailor the approach to the patient. However, what's not unique and what's kind of a universal principle is high-risk patients need to be treated immediately, no matter what you treat them with, but they need to be treated immediately. And that's the Zelenko protocol. It's common sense. You know, don't let people get sick. Treat them, intervene early when you can. So that's basically how it evolved. And you know, since then I came across tremendous amount of opposition. I was never in the national spotlight or international spotlight. I had nothing to do with politics. I was a country doctor for a community for 20 years almost. And all of a sudden I'm thrust into this national spotlight because hydroxychloroquine became politically toxic, had a lot of political side effects. So, and economic side effects, because the treatment that I was advocating cost $20, the whole course of treatment. Generic drugs, safe, available, oral, could be given at home. It's the perfect storm of medicine and it's the safest medication in the history of medicine. I'll say that again because that's the false narrative I'm trying to debunk. Hydroxychloroquine is the safest medication in the history of medicine. And why do I say that? Because it's been around for 65 years. It's been approximately given 100 million times to patients. It's given to pregnant women. It's given to nursing mothers. It's given to children. It's used for malaria prophylaxis, and rheumatological diseases such as lupus and rheumatoid arthritis. So, and it's currently being used in millions of patients while the fear-mongering was going on. That if you take it for COVID-19, you're going to die. It was still being advocated for the use of all those other diseases I just mentioned. The hypocrisy was nauseating. So I saw right through it, and I didn't care. But the damage was done. The propaganda was amazing. Doctors were afraid of losing their credentials. Patients were afraid of dying. And so pharmacies were afraid to give the medication. So essentially, the access to this care was non-existent unless you were creative. And so then I started trying to figure out how to beat the system. And I realized, you know, I call it the medical Second Amendment. The Second Amendment, right, the right to bear arms, has a very unique, distinct purpose, which is that if you have a tyrannical government, the citizens should have the means to defend themselves, hence the guns. Well, we have a tyrannical government, and it's not the issue of guns, it's about issue of access to life-saving information and life-saving medication. And that's being blocked by lack of political will or conflict of interest or it's a complex analysis, but nevertheless, patients are not getting the medication that they need. So I needed to figure out a way to beat the system. So the way that these drugs work, it's very elegant, it's really interesting. But zinc, I'm going to keep it simple. Zinc kills virus. Zinc cannot get into the cell by itself where the virus is. The hydroxychloroquine opens a door in the cell, lets the zinc go inside. So it's like a gun and a bullet analogy, right? A bullet is lethal, but you still need a gun to be able to deliver it, right? Without a gun, a bullet is useless, and without bullets, a gun is useless. So it's the synergy, the combination of the two that create a functioning unit. So all these studies that were done with just hydroxychloroquine alone were designed to fail. It would be by way of analogy, I give you an unloaded gun, and you conclude that the gun doesn't work. That's not a correct conclusion. The conclusion is you didn't give me bullets. If you gave me bullets, I would know if it works or not. So that was actually the nefarious, and they knew about it, by the way. This was known from 2005. This information. So this was very clever, and it was done to create a negative fear and false propaganda against pre-hospital care. We can ask the question, who benefited from that delay in treatment? But that's for another conversation. So I needed to find another way to get zinc into the cell. So it turns out that there are two naturally occurring substances that people can buy over the counter in a health food store or pharmacy that does essentially the same thing as hydroxychloroquine. Okay, if hydroxychloroquine is a 50 caliber machine gun, so these other two maybe are 22 caliber pistol, but nevertheless, you know, there's a saying, you don't go to war with the army you wish you had, you go to the war with the army you do have. If you can't get hydroxychloroquine, it doesn't help you, so we need to find something else. So there's something called quercetin. It's a plant derivative of the bioflavonoid. It's safe, it's cheap, it's available. Quercetin. I'll ask you to perhaps mention my website. It's free, but it has all the printed protocols there, so people could use that as a reference.
Go ahead.
But anyway,
go ahead and mention the website.
Oh yeah, it's my name. It's Vladimir Zelenko MD.com. Again, Vladimir Zelenko MD.com. And over there you'll have links for prophylactic approaches, both prescription and non-prescription, and then treatment approaches, and also all the relevant studies, so professionals, physicians, researchers could actually use that as a resource. And then there's a lot of other information that I think is life-saving. So, Twitter threw me off. I had 163,000 followers in 3 months, and my tweets were getting 10 million impressions, and they threw me off for platform manipulation. I don't even know what that is, but that's their claim. So I've been censored, and so I had to create a website so that when I talk to people like you, I can refer patients to it to get this information. It's a welcome to the United States of communism.
Kind of, yes. That's so you don't have any reason to know why they threw you off? I mean, you didn't tweet something specifically. They just decided one day to say you're violating our platform guidelines?
Oh, I mean, I know exactly why. I mean, they suspended me twice for violating their community standards. And then they said their community standards are set by the standards of care of the WHO, which is the World Homicide Organization.
Right.
And the WHO, since the United States withdrew from it and took $450 million a year in funding, is now exclusively supported by the Bill and Melinda Gates Foundation and the Chinese Communist Party. And they have deemed hydroxychloroquine usage in pre-hospital care as dangerous and against the standard of care. And hence Twitter follows those recommendations. So another way of looking at it, Twitter is an extension of the Chinese Communist Party and the Bill and Melinda Gates Foundation. That's just a matter of fact. Mm-hmm. And it's unbelievable. And you have to ask yourself, well, why did the WHO ban or put a moratorium against the use of hydroxychloroquine? Well, that happened after the Lancet published a study based on almost 90,000 patients that hydroxychloroquine ended up killing people. There was only one problem, that study was based on fraudulent data, and 2 weeks later was retracted. Mm-hmm. So that was absolute lies, but the damage was done. And so there was a lot of noise when the study came out. There was zero noise made about the fraudulent academic fraud that was perpetrated on humanity. And what's even more nefarious, the FDA, a wonderful FDA, withdrew the emergency use authorization for the use of hydroxychloroquine. And if you look into their document, one of the reasons why they did it was the Lancet study. Now, here's the key. But after it had already been withdrawn for fraud, they still used it as a basis for removal of the emergency use authorization. So American people, whoever's listening, your government thinks you're stupid, and they think that you're sheep that could be led to the slaughter. Well, I'm here to tell you that that's not the case, that you have free choice, and you don't have to submit to a tyrannical government. And what I mean by that is you should take your own healthcare, take your healthcare into your own hands and protect your family. So every American home, every home should have quercetin. The other compound, I forgot to mention, which is over the counter, it's called EGCG. It's an acronym for a long word. And it's a green tea extract. It also has the same exact zinc ionoform property, which basically lets zinc into the cell. So here's the dosing you'll look up. I have it written, but you need quercetin and or EGCG. You need vitamin C, you need vitamin D, and you need zinc. And if you're in the high risk category, you should take prophylaxis so that you don't get it. And if you do get it, you should start treatment immediately, even if you think you have it. That's the key. So you don't need to know for sure. Even if you think that these are safe drugs, the risk versus benefit analysis favors treatment because COVID-19 is so dangerous in a subset of patients that it's much better to treat than not to treat, in my opinion. If you're going to talk about the vaccine, so let me explain to you things in a more broad way. There are 4 aspects to a pandemic response. Number 1 is spread prevention, which means basically, to slow down the actual spread. Number 2 is pre-hospital care, meaning if someone gets it, you want to treat them right away, not wait until they get sick. However, a subset of patients will end up in the hospital. So when they're in the hospital, you need to know how to treat them in the inpatient care. You need to know how to treat them while they're in the hospital. And then number 4 is vaccination. This is developing an immune response, perhaps through administering a vaccine. So here comes the question. Let's assume it's a good vaccine. It's a big assumption here, but for the purpose of a thought experiment, let's assume it's a good vaccine. But who are you going to give it to? Would you give it to anyone that has a 99.998% chance of recovering on their own from COVID-19 with no intervention? And that's the majority of people. That's the young and healthy people, the statistics. These aren't my numbers. The data shows that 99.998% of the low-risk population recover on their own without any intervention, which I figured out on my own in March because I wasn't treating these people, right? And they all survived. So why would I vaccinate these people? For what reason? Also, why would I vaccinate someone who had COVID-19 and has antibodies? Right? So assuming it's a good vaccine, and again, it's a big assumption, the actual people that would benefit from the vaccine, it's rather narrow. It's the elderly population, nursing home residents, people that have high viral load exposure, people in critical infrastructural positions in our society, doctors, police, military, people that you can't replace so easily, and you can't have them stay home for 2 weeks. Those also, it's a consideration. People with medical problems, and anyone who wants. It's a free country, right? You have free choice. If it's something that you choose, if a patient comes to me and says, listen, doc, I want the vaccine, I'll give it to them. I'm all for free choice. The tyranny is if the government takes a gun to your head, essentially, and says, you better take it. And that's what I'm afraid of. For example, and I'm making a lot of noise about it because I do see it coming, where the schools are not going to accept your kids unless you have proof that they took the COVID-19 vaccine. Now, they don't need it, in my opinion, unless the child has medical problems. But in general, most children don't need it, in my opinion. So all of a sudden, you have a situation of tyranny. So That's my opinion. Now, whether or not this vaccine is good or not, I'll just say it's too early to tell. And the reason why I say that is, on average, it takes 20 million dose administrations to get a full side effect profile for a vaccine. That's the normal development of vaccines. Now, I'm not faulting anyone. We are under World War III conditions. And I actually mean that, because more than 200 countries are being attacked by the same invisible enemy. If that's not a world war, I don't know what is. But we're under a crisis. So under crisis situations, we do things differently. And I actually was okay for pushing things through quickly. However, you have to be honest with people. You have to say, listen, we pushed it through quickly. And by doing so, there may be risks that we have not yet ascertained. Mm-hmm. You need to know that. People have free choice. You shouldn't go tell them it's safe, or we know for sure it's safe. And also, you don't know how effective it's going to be. You know, there's a new, it's not a new strain, actually. It's a mutation in an old strain in England right now, which basically, if this is the virus and this is the cell, so there's on the cell is a receptor. The virus connects to it and then enters the cell. And so the way it connects, it's like a male and female part. So the virus has a male part, which is called the spike protein. And there's been a mutation in the spike protein, which makes it fit better. It's a better fit into the receptor of the cell. That makes the new mutation much more contagious. Actually, the estimate is 70% more contagious. Not more virulent, which means it has the same effect on the person. In other words, it doesn't kill more or less than the other one, but what it does is it's easier to get. Mm-hmm. And that's an important issue, because then it could spread to many more people quicker. So that needs to be, and it's not clear if the vaccine, which was designed for the old one, will work for the new one.
Interesting.
What is clear, that the mechanism of action of the approach that I've advocated for is the inhibition of replication of the virus. And that is the same for both strains. So that approach, according to everyone, will work. That has not changed. So that's my answer to your question. I think we took my attention, but that's what happened.
Well, it's interesting, because I talked with multiple doctors, and some of them have been afraid to prescribe HCQ.
You know why?
Please tell me. I believe I know why, but I'd like to hear your perspective.
Well, let's assume it's a good person. Being a doctor doesn't make you a good person. It just means that you graduated from medical school. There's a joke. What do you call someone who graduated last from medical school?
Doctor.
Doctor. Anyway, but let's assume it's a decent, normal person. Well, it took him at least 11 years to become a doctor. 4 years of college, 4 years of medical school, minimum 3 years of residency, probably $300,000 to $500,000 of debt, a tremendous sacrifice on your personal life. And finally, in your mid-30s, you get your credentials, you're trained, you're married probably, you have a family, you're trying to support them while you pay off your debt. Now comes along COVID-19 propaganda, and basically in some states, for example, doctors were threatened to lose their credentials, to get censured, to get incarcerated even. It's human nature to want to protect yourself. So that was a very effective way of preventing doctors from using hydroxychloroquine.
Well, I'd like to discuss what I call the medical industrial complex, the global medical people who went to bat. I mean, they went to war against hydroxychloroquine, as you were talking about earlier. Suddenly, after, like you said, 65 years of safe use for hydroxychloroquine, doctors who treated only lupus patients and used HCQ on their patients for decades with no side effects,
Suddenly this medication is deemed the enemy by publications everywhere, all around the globe. There's just all these things cropping up. And I'm watching that happen. And I'm thinking, wow, the deep state is deeper and stronger than I thought. Intellectual honesty in journalism is missing. Few men have the virtue to withstand the highest bidder. Because I'm guessing some phone calls were made and people were told you needed to write articles bashing this medication. And people that I know who ordinarily I would consider to be intelligent and trustworthy were buying into it. Do you have anything to say about that?
Yeah. So the amount of academic fraud that was perpetrated on the humanity is akin to crimes against humanity, because it spread a false narrative that has directly resulted in the death of hundreds of thousands, if not more, people. Now, my data, which has now been reproduced by hundreds of doctors and studies on multiple continents, I just happened to be the first. So then I got vilified because it's anecdotal, right? The first is always an easy target, but subsequently it has been reproduced hundreds of times. All this is available, it's a matter of record. Shows an 84% reduction in the need for hospitalization. So it's just to give you a sense of scale. If we have 300,000 dead Americans, we could have prevented 84% of that. That's 250,000 people.
Mm-hmm.
What that means is an 84% reduction in the market share of hospital medications that are needed to be used in the hospital. It also shines a light on the fact that the vaccine has limited utility and limited indications. In other words, out of 100 people, maybe only 3 or 4 would benefit from the vaccine. That's not the narrative we're being sold, right? That everyone should get the vaccine. So you have to, that's a matter of fact, that what I had been advocating is a threat to the vaccine industry as well as the therapeutic industry. Not to mention the fact that there was a threat to the enemies of the president, because the president actually came out, rightfully so, and he was right. It's a matter of record that he supported the use of hydroxychloroquine. He felt that it was a game changer. It's a matter of public record. So anyone who was interested in bringing him down, many people, were all of a sudden developed a strong aversion to hydroxychloroquine use. It became political, it had political side effects. But I think there's something more going on here. I think that there's this coordinated, there's too many things that have been choreographed to just say that this is a random event. I think that this crisis, whether or not it was caused by God or a human being, I'm not commenting on that. But I can tell you for sure that this crisis has been hijacked by certain forces to achieve a certain agenda.
Sure.
You know, you never let a good crisis go to waste. So,
well, you have actually, I've noticed when I was following you on Twitter that you had retweeted several of the articles that I had written for Uncover DC. And in those articles, I had pointed out, maybe it was those articles, maybe different articles, but I remember writing several times about how Anthony Fauci sits on the leadership advisory team for Bill Gates' Decade of Vaccines, a project he launched in 2010. And I knew that already. So when I saw him poo-pooing hydroxychloroquine and saying that there needed to be studies and research, and I'm looking at his motivations, I'm going, what's really going on here? And it was kind of obvious to me. And I agreed with you. It's criminal. It is crimes against humanity for a profit and bullying. I know we've had people making phone calls into the state where I live
convincing people to mandate masks and things like that. That's a whole different conversation. But I want to know, I'm curious what you might have heard about all of the pressure on the medical community itself. I have seen otherwise intelligent doctors poo-pooing HCQ, mandating masks when I don't see much scientific evidence for the use of masks in preventing viral transfer. And I'm seeing a lot of money flow into these states just because there's positive cases. So have you heard anything, any rumblings in the medical community at all along those lines of how money's flowing in and out because of HCQ, because of this virus?
So first of all, Fauci's a whore who prostituted himself.
I would agree with that.
I don't think he even knows who his pimp is anymore, but he sold his soul a long time ago, even during the AIDS crisis in the 80s. But he's only a figurehead. There's many levels. One of the main culprits here is, his name is Rick Bright. Not so bright, I call him, Dr. Bright. And the reason why I think he's directly responsible for the death of 250,000 people. I'll tell you why. There's a documentary called Totally Under Control. How do I know about this documentary? Is I'm in it. And it was a Trump hit piece. It just came out in a week before the election. And before my segment, this Bright, Dr. Bright, is interviewed. So everything I'm about to tell you are his words, not mine. So Bright, who was in charge, he worked for the CDC. I think he was in charge of vaccine development, and he headed a team called BARDA. And he received a phone call. This is what he says, that the president ordered Secretary Azar from the HHS to make hydroxychloroquine available to every American who wants it. Azar then delegated the task to his attorney, the attorney for HHS, Dr. Kadlov, I think his name is, and he called Bright, Dr. Bright. And Bright describes getting the phone call, and he's saying how he disagreed with the president and how his team very creatively crafted an emergency use authorization to limit the use of hydroxychloroquine for hospitalized patients only. And this was to make the government stockpile of medication available, but only to the hospital setting and not to the patients in the community setting. Then he says he was very proud of himself, his team, for protecting the American people from this great evil. He didn't use the word evil, but from this great threat that the president's directive was. So he was insubordinate, and he was fired for that. But because of that, every doctor that I know was afraid to use it in the outpatient setting because it was only authorized for hospitalized use. Now, in reality, it meant that the nation stockpile could only be sent to the hospitals. It didn't say that physicians cannot prescribe the medication to their patients. But it was so creatively and effectively, the propaganda spun, that it made it seem as if a physician who would use it in the pre-hospital setting would be killing their patients. So because of that, essentially the entire medical community in this country stopped using hydroxychloroquine in the outpatient setting, hence the death rate. Now, in terms of financial incentives, it is clear that hospitals get funded much more for COVID deaths, and they get government supplements or whatever it's called to deal with the COVID crisis. There was a lot of financial incentive to codify death certificates as COVID-related, even if they weren't. So there was a lot of corruption. But I think that there is a more nefarious motive here, which is the destabilization of our society. There's nothing, the fear, so this I want to address this to the American people. You have no reason to be afraid from COVID-19. There's reason to be afraid from the government, but not from COVID-19. And the reason why I say that is COVID-19 is extremely treatable. It's not a good infection, but it's treatable if you just follow common sense. And more people are dying from the governmental response to the COVID pandemic than from the COVID itself. And what I mean by that is that the lockdown itself is killing more people than the virus. And there's a lot of evidence for that. There's a lot of collateral damage. The suicide rates are up, in some places up to 600%. The child and spousal abuse, that's the real pandemic right now in America. The amount of people dying from preventable illnesses like cancer that could have been detected early, or routine medical care for like heart disease, diabetes, things like that are easily managed under normal circumstances, and not so easily managed when you don't have resources or access to care. So there's been, and not to mention the psychological trauma that its effect has not yet been fully assessed from the financial loss and destruction of the middle class of this country, the small businesses that have been wiped out, and people's life's work, ambitions, and hopes and dreams have been wiped out. And that has a lot of ramifications on a family. Not to mention that children learn from facial cues. So by covering everyone up with a mask, there's a Dr. Simone Gold. She's brilliant, and she has a good analogy. She says, wearing a mask for COVID is like trying to catch a mosquito with a chain link fence. And what that means is that the COVID-19 size is 0.1 microns. The masks, the ones that most people wear, only block things up to 0.4 microns. That means the virus just goes right through the fabric. It's the biggest joke. It's a sad joke, but what it's doing is covering up the faces of people and leading them to social isolation, and actually affecting the way children develop. We're raising a generation of autistic kids potentially. So there's a lot of terrible, by the way, not to mention that your immune system works by being challenged through exposure. So every time you go outside, you're attacked by 1 trillion viruses. A normal person's immune system just fights them off, and it becomes more robust to handle other infections. By staying home and isolating yourself, over time you're weakening your immune system, which makes you more vulnerable to every other infection that usually you wouldn't be vulnerable to. So the ramification side effects of our response, in my opinion and in the opinion of many smarter people than me, is much more damaging than the actual virus itself. So, but it's effective if I want to create panic in a society. And then you couple that together with riots and anarchy in the streets. Then you have social media censorship on a scale that would make Stalin proud. And you have to ask yourself, what is going on here? What are we living through? There's a change. There's an attempt to change the way society lives. Everyone's calling it the new normal. But what does that mean? And why is it being done? So before I get into my conspiracy theories, I just want to keep it very simple. There's nothing new under the sun. What we're seeing now is a replay of a historical pattern that is just now being manifest through the COVID-19 battlefield. But it's not really the COVID-19 issue. There's a tension going on here between two ways of looking at humanity. There's one that is God-centered consciousness, which basically implies that we're made in God's image. And since we're made in God's image, we have human rights. And our life has sanctity. And that's the basis of natural law, that we are entitled to be respected and we have basic rights because we're created in the image of God. That's actually been the traditional Judeo-Christian view of the world. Now, there's another way of looking at the world, which is a derivative of a pagan, or let's call it Darwinism idea, where survival of the fittest, where there's a hierarchy of value structure, and those that are strongest, or those things that give you the biggest survival benefit, is considered the best, and everything else is considered worse. So in that framework, it doesn't really matter the sanctity of life. What matters is who's on top of the hierarchy, who's the Übermenschen, who's the and that human being is no different than a commodity. They're like a monkey, and you can buy a monkey, you could sell a monkey, you can slaughter a monkey, right? Because it's an animal, or a deer, or whatever, a chicken. It doesn't matter. You get the point. So if a human being is no different than that, so then we can get into very interesting analyses. We could say, well, after the Civil War, the human slave trade, that's always been the most lucrative commodity and industry in the history of humanity. If you look through the economics of it, you'll see that it's more lucrative than the energy sector, it's more lucrative than the narco traffic. So the human commodity has always been very valuable, especially if you can own it. Now, after the Civil War, half the country lost a lot of assets, and that which was a commodity became a liability, because these people they needed to be supported until they came on board in terms of opportunity. So they became a tremendous financial burden. So there was an attempt to what's called the Black Genocide, and it's still going on to this day. It basically goes to the Planned Parenthood clinics that are all in the Black neighborhoods and Hispanic neighborhoods, almost exclusively. And it goes back to Margaret Sanger, who was a proponent of eugenics, which was a derivative of Darwinism. So anyway, this is all a matter, if you just follow history, you follow the patterns of behavior. And one of the favorite students of Margaret Sanger was Goebbels and Himmler. And they followed her ideas of sterilization and genetic superiority to kill the Jews in the Second World War. So now you're going to say, why am I bringing this up? Well, it's very relevant, actually, because now the target population that we're trying to exterminate is the elderly and the infirm. Look at this virus. Again, I'm just describing to you properties of a virus that is well established and well known. It's spread for around a week while a patient has no symptoms. It attacks the old and the sick and kills them, and not the young. It came out of China from the Wuhan province, which was a mile away from their level 4 viral facility, the highest level bioweapons facility in China. Okay, this is all circumstantial evidence, fine. But the point is that if I were to design a bioweapon that would clear out the riffraff, or those that were a drain on society, who were taking more than giving, this would be the perfect weapon. And if you look at China, right, they have anyway restrictions to having one child per family, unless you get special license or permission. It's in their interest to thin out the herd. Bill Gates is on, go to TED lectures, listen to Bill Gates. He says the world needs to be reduced by 25 to 50% population because of global warming. Whatever the terminology. There is an active, so that's by the way, if someone is on record saying that he wants to reduce the world population, and why would I take his vaccine to protect me? Huh? Whatever. So just the pieces are too easy to put together, but the enemy has been so well. The Talmud says you can learn from a thief. The enemies of humanity have pulled off a amazing project. I mean, I have to tell you, I have to give them credit. It's evil, it's nefarious, it's terrible, but it's brilliant. and we should learn from them because we need to defend ourselves from it. But they've been able to harness every aspect of society to come up with a mass pandemic of fear and anxiety that takes away people's God-centered thinking and puts their faith in human beings, into man. They created an artificial crisis and then give you an artificial solution, but only if you bow down to them. So it's unbelievable to me how wicked and evil and in plain sight, it's the elephant in the room, this crime against our society has been. But nevertheless, the biggest threat to the plans of the globalist Satan is truth, is the spread of truthful information, is empowering the people of this country or of the world, saying, well, you don't have to capitulate. You know, there's 350 million people in this country. There are more guns than that in this country. And my advice to the American people, hold on to your guns. And I'll tell you why, because they're afraid of a mass uprising. They're afraid, like, for example, if my children are going to be told they can't go to school unless they get the vaccine, they're not going to school. And there's a saying, which I really think is true, I'd rather die standing than live on my knees. So the reason why I'm a scientist, I came up with an approach before anyone else through God's graces. I was attacked and eviscerated. I almost lost my marriage. I lost my job. I got recurrent cancer in the middle of all this. And a lot of other vilified in the media, but I don't care. What I care about is that the next generation lives in a world that is more divine, that the presence of God and God consciousness is more palpable and not less, that there's the more light and not this darkness that's being, this cold, long, dark winter that's being perpetuated and implanted upon us. So, and this is why I'm doing these interviews. I really feel that the American people and the people of the world need to understand and have perspective of what's really going on. That this virus and the vaccines and the response and the fear and the lockdown and the political restructuring and the move away from the traditional way of doing commerce to a cryptocurrency, it's all about facilitating a transition from freedom to slavery. And because if everything goes crypto, what that means is it's very easy to manipulate the behavior of people. Because if I don't like the way you behave, I'm gonna control the flow of your ability to do commerce and to buy stuff and to feed your family. So, and that's where things are heading, by the way. So I think that the call to action right now to the American people is wake up. The trap has been set, but it has not yet closed, and we can still do something about it. And the key here is information. It's the flow of information. And apparently the enemy thinks, when I say the enemy, I mean those forces that oppose the revelation of the presence of God and human freedom, think that they can manipulate the flow of information to guide us into the slaughterhouse. And we can use the same exact tools that they're doing against them. The Psalms of David says, with a crooked person, you have to deal crookedly. You have to learn I'm learning very quickly the skill of propaganda, because But propaganda doesn't mean bad. It just means effective messaging.
Effective messaging. There's another scriptural verse where we're supposed to be wise as serpents, but gentle as doves. So we can be wise as serpents with all this, is what you're saying. And it's been very interesting to listen to you, because I think if you were having conversations in my house for the past 8-9 months, you'd be fitting right in. Everything you've been saying has been an absolute pleasure to listen to hearing the same concepts put in your words and very eloquently. And I appreciate your time. I know you got to get going here, but so how do people get a hold of you?
I think probably the website is the best way. You can message me through the website.
Awesome. Excellent. Well, Doctor, I thank you so much for taking the time to speak with me. It has been very informative, and I really hope that what you were saying comes true, that we do get the message out. I know we're working hard at this end to do that, and we join you in that effort, and we thank you that we are working together to get truth known. So thank you so much.
God bless you. Thank you.
I want to encourage you to share this interview with as many people as you can. The truth needs to get out of what happened out there. And of course, you can always follow up with Dr. Zelenko by visiting his website, which is VladimirZelenkoMD.com, VladimirZelenkoMD.com. If you'd like to reach me for any reason, just send me an email, newbookofdaniel@outlook.com. Find me on all the social media platforms by just looking for New Book of Daniel. And of course, if you'd like to follow my political writings, you can do that by visiting uncoverdc.com or Red State. This is Daniel Bobinski. I thank you very much for listening. New Book of Daniel is produced by Shadow Trail Media, copyright 2021. We'll catch you on the next show. Until next time, be blessed.